Welcome back to Prognosis. Today we're going to do a quick overview of the appointment schedule screen. To access the appointment schedule screen, go up to Appointments and Schedule. At the top of the screen, you'll see some icons. The first says Patient. When you have it on Patient and you search in the binoculars, it will show you all the appointments for patients that have scheduled appointments. You can search for the patient by last name. It'll give you the date and the time of their appointment. If you change this to Other and you use the binoculars, it will show you other types of appointments. This one says Conference for Dr. Marcus Welby, and then at 9:15. This right here is one way that you can add an appointment. So you click here and it opens up the appointment schedule screen, and then you can create an appointment for a patient. Here we have the appointment history button, which is going to show you all your patients and all the history of all their appointments. Here we have a patient receipt. Patient receipts are for those patients who do not have an appointment today, but stop by to make a payment. So you can take their payment and then print them out a receipt from here. The next line down shows a box over here to the left that says to be confirmed. So if you have patients on the schedule whose appointment needs to be confirmed, you'll see them in this box. This telephone button lets you switch to the different types of appointments, like health maintenance due, vaccine due, follow-up due, and so on. You can add the date range that you want to search for, and then click OK, and it will come up for those appointments. The next box down is going to be a calendar. The current day is always going to be in red. The T will always bring you back to today. You can go backward or forward a day using the arrows, and you can go backward and forward a month using the arrows here. The next box down is patient information. So when I select a patient on the schedule, and I come down, it will put their information down in this box where the patient has an icon tray to get to other types of screens from this screen. You also have a hyperlink to the patient's demographic screen, so you can get to the patient demographics from here. This is just a info card, so it's just going to give you information about the patient on this little card. Here we have a door to arrive your patient. The $ is to take a copay for a patient that is on the schedule. The advantage here is when you're taking a patient copay for a patient on the schedule, you'll put in that copay amount, but then also you can apportion it to a deductible, visit, or copay, and it will automatically apply for you. Right here, you have a time button where you can actually change the time on the schedule. So as you can see right now, the time is in 15-minute increments. I can change it to 5-minute increments or 10 minutes, 20 minutes, 30 minutes, and an hour, just by going to that little time button and saying OK. If you look across the top here, you see that we have providers and location. Right now it's set to all providers. But if I go to a daily view, I may want to select one specific provider. And if I've added a specific location, I may want to choose the location that I'm at. When I'm also on this daily view, I actually get some more icons across here. The first one is to block time. Block time allows you to block off a section of the provider schedule. Enter the date and the time that you would like to block off. So let's say that we want to block off from 12 to 3, and we're going to give a reason. Here's an appointment. And say OK. It will put a black box on that schedule so that you cannot schedule during that time. This button is an appointment exception button. It allows you to make an exception to the schedule for that one day that you're on. You can also print your schedule, and this is a mass scheduling button. So if you have multiple people on your schedule and you want to move all of them to another day, you can use the mass scheduling button. This little button here refreshes your schedule, and this is your current date. You can go backward or forward a day on your schedule using the arrows. And down at the bottom, we have a Legends button. The Legends button explains the different colors on your schedule. So if you have different colors for each one of your encounter types or your appointment types, you'll see different colors as you're making those appointment types. Each one of the locations also can be in a different color, so you can just know exactly what location that appointment will be by looking at the color. And then we also have a count button, which will give you the count of the patients on your schedule for today. Notice at the front of each one of the appointments that are on the schedule, you have 3 little dots. These can have letters in front of them. V means your insurance has been verified. C means your appointment has been confirmed. And P means they filled out patient paperwork. The color in the front here indicates that the patient is with the provider. This color can be different colors as well. It could be yellow if it is marked arrived. It could be green if they're with clinical staff. It could be pink if they are completed the encounter. And that is a quick overview of the appointment schedule screen. Thank you for watching.